Now, the Public Servants Association says most of its members are considering opting out of their Government Employees Medical Scheme, or GEMS. This comes after the announcement that the subscription will be increased by 13.4% in 2025. The union says the move will mean many public servants will be unable to afford medical aid. Claude Naicker is the PSA spokesperson and joins us now. Claude, thank you so much for the time. Really appreciate it. I mean, basically the sentiment here is ultimately it is just far too expensive. Has a reason for that 13.4% increase been afforded to you at all as the PSA?
Good afternoon to you. Here in modern society, you would think that medical aid is a necessity, but the way the increase is proposed by GEMS for next year, averaging around 13.4%, I think it no longer becomes a luxury, or it will become a luxury rather, and people might opt out of it simply because it becomes unaffordable. When we signed this agreement with GEMS some years ago, one of the visions and the missions of GEMS was to say that we will provide not only quality healthcare to our members, but affordable. And over the years, we've seen that the increases have been steep and it's now become unaffordable. The average increase is about 13.4%, but this obviously depends on the number of beneficiaries that you have. If you have more beneficiaries or dependents, that might go up to about 800 Rand per family. And I think this is simply unaffordable, and you'll find that most of the members will probably opt out of medical aid, leaving the medical aid in dire straits. And obviously, members' health concerns obviously becomes a major problem itself. So from the Public Servants Association side, we've attempted on numerous occasions to try and persuade GEMS not to consider such an increase, but to gradually try and increase the subscription in the forthcoming years. But unfortunately, they've already decided on this and have communicated to a number of members as to the proposed increase for 2025. And I can tell you, it has really infuriated our members. And we are currently in the midst of wage talks, and I think this will put a spanner in the works. No matter what wage percentage that we do agree upon for the next coming years, I think the increases by GEMS will simply erode the salary increase that we're going to negotiate upon. And I think it's going to leave members very destitute and out of pocket, and to try and accommodate themselves from purchasing basic items like food, electricity, and paying for transport. If they cannot afford that, they would definitely see medical aid as a luxury as opposed to a necessity.
Claude, do you think that it's all because GEMS is ultimately a monopoly in the way that it can offer this to public servants, that it's pretty much the only one that is able to do so? If that was eradicated, perhaps there'd be a little bit more competition. Or do you fear that that perhaps doesn't change things at all?
Absolutely. You've hit it on the head there. I think although you're not forced to GEMS, but indirectly you are forced to join GEMS simply because the subsidy that is afforded to GEMS members is considerably higher than if you would join an open scheme like any other medical aid. If I'm an employee of the state, would I rather get 2,000 Rand subsidy as opposed to 500? If I get 2,000 Rand subsidy and want to join GEMS or should be joining GEMS, then I'll obviously opt for GEMS. So indirectly, there is a monopoly. And this is obviously contributed to the stance that GEMS has taken over the last couple of years. They've just merely consulted, but not finding any consensus or not taking our points into consideration or our factors into consideration to say why you shouldn't consider such a steep increase. You will remember a couple of years ago when COVID had set in, those people that visited the hospitals were those that needed dire medical attention. But a number of public servants did not utilize medical services during that period of time. And during that period, we've argued with GEMS that you could have accumulated enough reserves to actually cushion any further increases in the coming years. But unfortunately, we realize that the rules make provision that you need to have so much of reserves in your kitty. But the reserves that you've accumulated during that period should be able to offset some of the increases that you're currently proposing. And I fear that come next year, when members or public servants do see the pay packets and they realize the steep increases that GEMS has actually proposed or implemented,
Yeah.
then I think reality will set in, and probably most of them will opt out of GEMS and go for other plans, which is much cheaper, or simply do without medical aid. And we'll have a ripple effect that you see a lot of public servants then visiting health institutions that are normally visited by people that don't have medical aids, putting further strain on obviously our health services that we currently face in South Africa.
I was actually about to ask then, Claude, then what was initially, before now, if that was the case, preventing Public Servant Association members then from actually going to other medical schemes as well then? What was preventing them, if not these increases, which clearly this is not the first time it's happened?
Absolutely. The main factor, if you'd ask any public servants, why didn't you go to an open scheme? The subsidy that is currently offered to those that are opting for open schemes is in the region of 1,200. But if you had to opt for GEMS, perhaps 2/3 of the contribution to GEMS is subsidized by the state. So anyone that is working in the public sector will naturally opt for GEMS because it's affordable and the subsidy is much higher. But when the subscriptions continue to increase over the years, then you find that GEMS is no longer affordable. And then you ask yourself, should I even belong to an open scheme, which I initially could not afford? Let me just simply opt out of GEMS, etc. And I think we're going to be heading for a crisis. As I said, you'll find that a number of public servants will be opting out of GEMS simply because they cannot afford it. Perhaps go for a hospital plan and take the risk of saying, hopefully I don't get sick, I don't have to visit a doctor. And if I do need serious assistance as far as medically is concerned, then I have perhaps a hospital plan, but pay for the day-to-day medicines that I require if I have to visit an ordinary GP as such.
Claude, what's a sufficient increase or subscription increase here?
Last year, the increase was in the region of 9%. We considered that considerably high as well. Remember, public servants' increases was pitched around CPI, meaning inflation linked. I think members, if GEMS propose an increase around inflation, they probably would have said, okay, we've accepted that. But to go not even double digit, but consider 3 times the amount of what we are currently negotiating for a wage increase, which is around 4.7%, you're proposing minimum 13.4%. I think that's ridiculous. So I think any increase would be problematic. But any scheme, any business needs to survive. And on an annual basis, you got to increase this so that your business can survive. And I think an increase more along the lines of inflation, I think would have been conducive, something we could have explained to our members, something GEMS could have communicated. Although it would have been hard to swallow, I think at the end of the day, members would have accepted an increase more around inflation as compared to 13.4% increase, which is way over the top.
Yeah, I know you've said that this decision has already been made, but is there any further sort of communication that can at least be held with GEMS, with government, with regards to this as well, and just to get a better seat at the table to understand this more and perhaps decrease this increase if that be the case?
Absolutely. We're going to continuously engage with GEMS to see if we can turn around the situation, to persuade them to perhaps defer the increases, perhaps after wage talks. This definitely is going to put a damper on the wage talk, which we're currently in the midst of. And this is one of the motivating factors that we're going to use at the wage talks to say, how can you afford public servants 4.7% increase? Whereas GEMS is increasing, which is the government employees medical scheme, is proposing an increase of around 13% minimum. So whatever increases that we do negotiate and accept is going to be completely eroded by January. And come April next year, when increases do take effect, employees will be worse off than what they currently are. But as I said, we will continuously campaign GEMS, and we will lobby perhaps the minister as well to say, listen, reconsider your decision, let's delay this and come up with a plausible increase that members can actually live with.
Makes sense. Claude, wish you all the best with that as well. Then Claude Naicker is the Public Servants Association spokesperson, then joining us as PSA union members, then really looking at perhaps ending even their GEMS membership because of their increase. That's currently double digits, 13.4%.